Thank you.
Okay. So professionalism requires that we place the interests of the patient above those of the physician. And essential to this is the public trust in physicians. And so the public trust that we have integrity, we have high moral standards and all that. So there are 10 professional responsibilities that we are all supposed to imbibe. That is professional competence, honesty, confidentiality. And in this current era, pictures, WhatsApp, Facebook, I mean, over the past few days, there's been an influx of pictures and privacy issues on social media. I remember there was some post of a patient in a ward with rain. There was water falling, and then this patient was lying there with an oxygen cylinder. That violates privacy of the patient. It was all over social media. And sometimes you have patient folders with diagnosis circulating and all that. So in this modern era, the social media is also part of the confidentiality. And so we need to be very careful about the pictures that we take on the ward and how we circulate them, even amongst our medical circles. We also have a commitment to improving quality of care. So looking for ways to stretch our scarce resources to improve access to care and commitment to a just distribution of finite resources. Commitment to scientific knowledge, so improving teaching and learning, commitment to managing conflicts of interest, and then commitment to professional responsibilities. Now, these are a few pitfalls to good communication: language, educational barrier, cultural barrier, lack of time, and lack of patience. A lot of the time, the patients may want more time to understand our diagnosis or to understand the implications of treatment. If you realize that you don't have time, it's best to schedule an appointment for future to continue your engagement with the patient. The goal of the patient-clinician relationship is healing, and it is the basis of it is trust. We should always know that the sick person, we shouldn't take advantage of this vulnerability. Let's look at paternalism versus autonomy. So in paternalism, the physician knows best and is the best judge of what to do for the patient. This usually pertains in pediatrics, and the physician does what he or she thinks is in the best interest of the patient, even if it is against the wishes of the patient. But in autonomy, on the other hand, the patient has the right to decide what shall or shall not be done to him or her. And even where the clinician strongly disagrees with the patient's views and feels it is not in the best interest of the patient, he or she accedes to the will of the patient. And so sometimes in our clinical practice, we do what we call therapeutic alliance, whereby we sort of lean towards one or the other and try to sort of dialogue with the patient to find a middle ground. And sometimes this is very difficult, especially in a situation where the patient is very set on what they want to do. So we'll look at the Medical and Dental Council Act, which deals with improper conduct. And there are a few things that they decide is improper conduct. So covering and associating with an unqualified person. So you have a clinic and then you hire unlicensed people. So the people might have gone through the requisite education, but they don't have the license from the Medical and Dental Council to practice. So if you associate with such a person, you could also be culpable. And then it is well known that we don't advertise in our medical practice. Advice comes from the patient. Then it's important to uphold professional secrecy. You don't go talking about the case that you saw today in the consulting room and the details with the names and all that. You need to keep that. Then improper business relationship. So I have an ultrasound, I have a diagnostic center, and then I approach you. You are the physician assistant in the clinic across the road, and then I tell you that any patient you send to me, I'll give you 10% of that. That is an improper business relationship. Improper association with the patient in all forms. So sexual relationship, whatever. Then conviction for a crime. So you remember there was a doctor who was convicted for sodomy some time back. So his name will be struck off the register of the Medical and Dental Council. So once you are convicted for a crime, it is deemed improper conduct and you no longer be part of the register. Then influence of alcohol and drugs is also seen as improper conduct. Fee splitting is similar to the improper business relationship, whereby you have a business agreement. For example, with the pharmaceutical agency that, oh, every prescription of brufen that comes to the pharmacy will give you 1%. That's a fee splitting. There are strict rules on premises and door plates, the size of the premises, the size of the door plates and all that. So whenever you want to open a facility, you need to find out some of these things. And then there are also regulations from the Medical and Dental Council covering nursing homes in terms of the caliber of personnel who needs to be employed and the kind of care that is offered. Issuing of documents. So what I'll say about this is that if you are not qualified to issue documents, do not do so. And this pertains especially to excuse duty. A lot of our friends will use us or approach us for excuse duty when they realize that we are in a position to issue them. So you need to find out per your designation, how many days of excuse duty are you qualified to give? I need to find out what it is for physician assistants, but for the house officers, they are allowed to give up to 3 days of excuse duty. Anything above that needs to be countersigned by a specialist or their supervisor. And then medications. So some people will have blank prescription forms in their possession and then be issuing prescription forms. Your prescription ideally should have your name, you should have your signature, and you should have the date. And you don't just issue the prescription form indiscriminately. The prescription form is a legal document. So take note of the fact that because it's a legal document, it could be used against you depending on the content. So you should always be very careful whatever you issue on the prescription form. Then we have something we call infamous conduct from the Medical and Dental Council point of view. Now, this is a blanket term which is used for any behavior that brings the medical profession into disrepute. And it covers so many things. It isn't a definite definition, but it covers so many things. It can be moral, legal, or professionally wrong. And anything at all that brings the medical, my sudden stops, sorry, that brings the medical profession into disrepute called infamous conduct. So drunken behavior, a patient who like fighting with the patient in the consulting room, shouting on top of your voice, anything at all that makes it look unprofessional on your part is infamous conduct, and the Medical and Dental Council will not be happy with you. Yes, PAs are allowed to sign medical forms at the health center level. Yes, like an assault case. Yes, you're allowed to. If you are the highest qualified professional there, yes, you can.
How about the excuse duty?
Yes, so the excuse duty too, you're allowed to sign the excuse duty. I can't remember your limit in terms of how many days you can give. I remember for the house officers, it's 3 days. I can't remember for the physician assistant. But we should be very careful of being used by our friends to sign excuse duty. Your friend didn't go to work and then he calls you, Charlie, Maeshi. And then you go and sign excuse duty. There's no folder, there's no evidence of coming to the hospital. And then you sign excuse duty and write malaria. If they come to investigate and they find out, you'll be in trouble.
So,
hello, doc.
Yes.
When if the person, I let the person pass through the system.
I beg
to cover your back. Yes, to cover your back, you can let the person pass through the system. Pick a folder, you see the patient, then you write your findings, and then you can make your diagnosis and give the excuse you see.
Oh, okay. And that one, if the malaria is negative,
well, you know that it's not only when malaria is negative that you treat.
You can give, yes.
So, I mean, if your clinical judgment is right, why not?
Okay.
Look.
Yes.
Yeah, but okay, you finish.
Mm-hmm.
Regarding advertisement, assuming I'm a PA and I have my own clinic, though
yes.
I'm under medical and dental council, can I still advertise or I'm still restricted? I have my own clinic and I'm running my own clinic. I'm a PA. Can I still advertise?
No, nobody is allowed to advertise in the medical profession. But there are some things you can do. So you can't go and say that my clinic is the best, come to my clinic and this and that. But there are some subtle things that you can do. For example, you can be the host of a radio or TV program.
Okay.
Nothing prevents you from doing that. Okay. But you can't like put an advert in the print or the social. You realize that we do it a lot on social media, but actually you can't do it in the formal media, like on TV, have an advert and say that this hospital is here, is the best in the world, and this and that. So you find that adverts that we see are mostly food and beverages, but you don't find advertisements of medical services.
Okay, but can I give direction to my facility in case I'm on a program?
Oh yeah, that's why I'm saying that there are subtle things that you can do to attract people to your practice. For example, a pediatrician can go to a school and do a medical outreach for the children, and then share directions to the clinic. Okay. That one is social help, but you are using it inadvertently to advertise, but not advertising in the strictest form of it.
All right. So please, my last question: are PAs allowed to have their own clinic?
Yes. Okay. Yes. There's a separate regulatory body called the Health Facilities. They grant the licenses. I mean, midwives can have their clinic, nurse practitioners can have their clinics, PAs can have their clinics as well. So yes.
Thank you.
Madam, do you have to practice for some number of years before you will be granted, or provided maybe I have my money? So if I passed out and
per the regulations, to own a private clinic, you should not be in the public sector because of possible conflicts of interest. And so if you are doing your internship, for example, you can't own a clinic. Okay. But after doing your internship, if you decide not to work in the public sector, you can apply for a license if you meet the requirements of the Health Facilities Regulatory Authority. Then you can be granted a license and then you can practice. But you also need to have your license from the Medical and Dental Council. And that comes after you've passed your licentiate exam.
Okay. So it's not necessary I have to practice or I have to work for some number of years before I can be granted the license to open my...
You should not be doing your internship.
Okay.
So internship is like an apprenticeship.
Oh, not. Oh. Because I've Martin work in Framemu say with the PAs, you have to practice for no. Oh, please, let me ask my question.
How many
please.
years did you hear?
Some were saying 5 years.
Oh, 5 years is a long time. Let me clarify from the Medical and Dental Council, and then I'll get to you. Somebody raise their hand.
Yeah, so Doc, with the issue of publicity and then as in probably granting an interview, there was this instance in 2017.
Pardon?
With the issue of granting an interview and doing publicity, there was this issue on 2017, and then TV3 came to interview me on some issue, and when I responded, they were like, Director General said, no nurse or health staff should do this, blah, blah, blah. But fortunately enough, I was having an NGO that's also speaking to the issue of public health, so I filled it under. Then they also came again, say, so far as you are an employee, you are not supposed to. But what I want to clarify here is that I have a number of hours that are supposed to work for the government.
Yes.
8 hours a day. So when I'm done with that, anything I do after
that is your business. Yes.
So why should they be so strong on some of this? Maybe they should look at their policies.
So the thing is that when you are done with your government work, you are free to do whatever you want to do. However, if there's a privacy policy with your organization, so let me give an example. I work with 37 military hospitals. Per the military policy, you cannot go on air and talk about an issue as an employee of the hospital. So if you go on a TV program and you are going as a doctor who works at 37 military hospital, then you need to seek clearance from the military high command. But if you go for the interview and you say that I am from this NGO and we are championing this cause, then fair enough. Then your views are not held as the views of a doctor from the institution. I hope you get the difference. So probably you shouldn't have said that you are a nurse with whatever facility. You should have rather said that you work with this NGO and you are championing the cause of blah, blah, blah. Because you see, media goes very far. And sometimes some of the things that you might say would give a certain impression. So let's say I go on air and they are talking about challenges in the healthcare system. And I say that I'm a doctor in 37. And then I start citing examples. People would be of the view that that is what pertains in 37. But it may not necessarily be the issue. Or it may not necessarily be the case. And so once I say that I am from the hospital, then it is seen that you are representing the views of the hospital, even though it is not the case. So when you are going on air as a private individual, you need to make that clear and not add any other things. So for me personally, when I have any TV program or radio program or whatever, I just introduce myself as a pediatrician. I don't state where I work. And if they ask me, I'll just tell them that for the sake of privacy, I don't want to reveal my workplace. But let's just say that I had a private clinic. Assuming I had a private clinic and I wanted to promote my clinic, then I'll say that, oh, I'm a pediatrician in charge of this place. So every time people call and ask questions or call in, they would say that, oh, can I know where your clinic is, or is there a number to call? You see, those are indirect ways of advertisement. But once you go and mention that you work in a government facility and there's a conflict in terms of privacy or publicity policy, then you'll be taking up on it by whoever, the Director General or the public affairs person or whatever. There was this post on social media about a fire outbreak in the Kolebu. You see, later on, the public relations officer came out to say that it was untrue. But there were actual videos of babies being evacuated. You see, and that was so wrong. It breaches confidentiality because some of the babies' faces were shown. You see, and I don't know why health workers are getting into this frenzy of social media. Everything you take a picture and put on social media. I know it gives results, but I'm just wondering why we are using that as a means of drawing attention to certain things. Any more questions?
Madam, please, I wanted to ask about the conviction for crime.
About
I wanted to know the conviction for crime. Yeah. I wanted to find out what if the crime is not related to your job, but later on I saw about the infamous conduct. So I'm of the view that maybe even if it's not connected to the job, it might still be punished by the council. That's, I don't know if it's
yes. So for example, if you go and steal something and you are caught, you haven't done anything medically wrong. No. But the fact that you are persecuted and sent to prison, you cannot practice.
Okay.
You cannot practice because then you have brought the name of the medical profession into disrepute. I mean, medical professionals are held in high esteem in the society and all that. Okay. And so it looks a bit funny that you are an ex-convict and you are sitting in the consulting room writing medication. It sort of casts a slur on your integrity as a as a medical professional.
Okay.
Do you get it?
Yes.
Madam, I have a question.
Yes.
So, assuming someone tests for HIV/AIDS, or maybe is he or she qualified to practice? And secondly, why is it that if someone, maybe I go and do, I commit an offense which is not medically related, and I'm being prosecuted? Madam, what has it got to do with this thing that I will not be allowed? Because people should be given that chance.
That's why I'm saying that you bring them, you brought you brought the medical profession into disrepute.
Oh, wow.
Your first question was what?
HIV.
Okay, so it depends. For everybody, fitness to practice is a thing. Fitness to practice means that what your condition should not put the patient in danger. I mean, if you are sitting in the consulting room and you are examining patients and you are writing a prescription, your status as an HIV patient will not put the patient in danger. Okay, so once you are taking the requisite precautions, it doesn't, you are not supposed to stop practice just because you have HIV. No. Okay. Do you get me? Are you clear?
Not. Madam, he's gone.
He's gone out.
Okay, Madam,
yes.
Let me ask this question.
Okay.
It's okay.
Madam, question. I'm on better Wi-Fi, okay?
Hey.
Madam.
So far, thank you.
I'm on phone. So.
Madam, it's my turn.
Yeah, go on.
Yes, I want to know, are we to sort of treat our relative, or maybe we ourselves? Just want to know.
So ideally, you are not supposed to, because there's conflict of interest. But we find that we do it all the time. We do it all the time. I mean, if there's no problem, you get away with it. But when there's a problem, then you'll be hot. So it's not advisable to treat your own relative.
Okay.
It's not advisable.
Okay. Yeah.
Okay, madam.
Thank you so much.
All right.
My question is I have two questions.
Okay.
One, if suppose I have a friend working, we are all working in the same facility, and I've realized he's good, but this friend of mine always drink and come to work. Maybe I'll find a way to approach him in a way, but yes, still, but he comes and does whatever he has to do very well. But yes, he continues to drink and come to work, continue like that. What do I do? One. And second, I had a chance to attend a deba in one of the public facilities. And it popped up that we as a health professional, we have this priority. Like maybe if your relative comes, you know, you need to give them that priority, as in like give them protocol. They need not to follow cues and all that. And this one too, I did not really get understanding well. So if you can help me.
You didn't get the understanding. I don't get it. Were they saying that when your relative comes, you have to?
Yes, they are saying yeah, if your relative
like it is a rule.
I don't know if it is a rule. It's a rule in that hospital, or like it's a rule in the medical dental council that you have to give your relative the priority.
No, there's nothing like that in medical and dental council regulations. But because we are humans, in every institution, everybody wants to be seen to be important in their workplace. So, for example, it will look a bit bad if, let's say, my husband comes to the hospital where I work and he goes through the queue like everybody else. You see? So that would look a bit funny. And so I would do everything in my power to get an appointment for him, make sure that he's the first to be seen and all that. That is what we do as human beings. It doesn't mean that it is a rule in any book. Okay. What was your other question?
A friend of mine drinking.
Okay, so there's something called fitness to practice. If your friend or somebody you know, or you yourself, you're suffering from a condition which will endanger the patient, it is your responsibility to draw the attention of the authorities to it. So the first thing you can do is to talk to your friend, encourage them to seek help. If they refuse, then you have no choice but to draw the attention of the authorities, because you see, this would endanger the patient and will put all of you in trouble, because if the patient suffers as a result of the drunken behavior of your colleague, then the hospital can be sued and you could all be called as witnesses.
Okay.
Or let's say somebody is a surgeon, and then along the line, they develop Parkinson's disease, which causes their hands to shake. And so their hands are not steady. Such a person needs to stop doing surgery. And if you are standing by and you see that they are not stopping and they are still doing the surgery and their hands are shaking during the surgery, that's endangering the patient. So you need to speak up and have appropriate action meted out to the person. There was a nurse I know who was a pethidine addict, kept injecting herself with pethidine. People knew, but nobody was saying anything. And that is so bad, because you see, you put everybody in danger. Even the people who are on shift with her. If she makes any mistake, all of you will be called in as witnesses. You see, and so we have to be each other's keeper, but it doesn't mean we should be covering up other people's problems, or they need to seek help. We are all humans. I mean, if you have a problem, you need to seek help so that that problem can be addressed. Then you can do your work effectively.
Okay, thank you.
Yeah. There was somebody else who had a question. A female, I think.
Nana, I think she's cooking for the husband, so let's continue.
Yes.
Doc, please. My question is with relation to what, yes, Doc, with relation to what you just said. I have a staff like that, and she's been chanced down twice, and she injects herself. Now, my problem now is how do I go about the reports and what do we do? Because of her now we can't keep pethidine for the night nurses.
Yeah,
so
it's a very common thing. So what you need to do is you need to take her off the roster, and you need to get help for her. So you need to engage the services of a clinical psychologist in the unit and try and keep it discreet, because you also don't want to shame that person and expose them. At the root of it, you want to seek help for them so that they do not endanger themselves, the patients, and other staff on duty with them. And so what I would say is that seek help for her and take care of the roster so that she doesn't pose a danger to the rest of the staff.
Yes, doctor. Thank you.
So that is if you are the in charge or you are in a position to do so. But if you are not the in charge, then it means that you have to tell your in charge.
She works under me, but I supervise her at a private hospital. So as soon as I left the private hospital, I was called that I was working with this girl and I never did anything about it. And I told them I never knew. So it has just come up. That's why I'm asking this question.
Okay, so if you never knew, then you couldn't have done anything about it.
Okay. Okay.
Hello, Doc, please.
Thank you, Doc.
You're welcome. So we have less than 1 minute. So if the connection goes off, I'll restart it. But please go ahead with your question.
So what about the person being transferred to other department of the hospital where they will not be access to pethidine? I think that's one.
Yeah, but they can still get it.